I was born and raised in Delaware. I have to start off saying that Rehoboth Beach, place in my heart, all the Delaware, Newark, Main Street. So I'm a Delaware girl, born and raised. I live in Newtown Square, which is in Delco, Delaware County, just actually right by Chester County. And I struggled with an eating disorder when I was at AI high school. When I was at Coney Beacon College, and I say those words because they're very, it's very Delawarean to say that. And so I devoted my life's work and my career, now that I'm consider myself recovered from my eating disorder, to advocate and lobby for better access to care in the state of Delaware, but also nationwide. Just a couple things right off the bat. The state of Delaware has no eating disorder treatment facility unless you're an adolescent. You can go to Nemours, which is AI DuPont Hospital. So Delawareans are already at a disadvantage for receiving life-saving care, and I say that with Medicaid and Medicare in mind. If you have private insurance, Blue Cross, that kind of thing, you can kind of go to other places around the United States, but again, we're talking privilege. Just some statistics, 85,138,000 Delawareans, which is 9%, will have an eating disorder in their lifetime. Considering the size of our state, that's really concerning. As far as my recovery, I was privileged enough to go to some of the most wonderful, exquisite, expensive programs, on the East Coast and even in the middle of the country to receive the life-saving care that I needed. But so many Delawareans, especially those that are Medicare beneficiaries and Medicaid recipients, they don't have that access. So I'm asking for Senator Coons to co-sign the Nutrition Care Act, which would benefit disabled Delawareans and also geriatrics of our state. 6% of females with disabilities struggle with an eating disorder, 3% of males with disabilities. Eating disorders can be potentially deadly in seniors than in the general population, as seniors are more susceptible to medical complications associated with untreated medical nutrition therapy is a critical pillar of eating disorder treatment for recovery, but Medicare Plan B does not cover it. Lack of coverage forces seniors to either pay out of pocket, which they likely don't have the monetary funds to do that, or simply forego care, which can lead to higher costs to the Medicare system in the long run. If they are not afforded specific outpatient treatment modalities, they're likely to be admitted to Christiana Hospital as an inpatient, and that's going to cost Medicare significantly more money. Medicare already covers medical nutrition therapy, but only if the person has diabetes or renal disease. Since medical nutrition therapy is a core component of eating disorder treatment, it should be covered on the same extent. So what is our solution? Nutrition Care Act allows Americans on Medicare Part B to receive coverage for medical nutrition therapy services for their eating disorders, just as they would be able to if they had diabetes. So even though it's a mental health diagnosis, they're going to get their coverage too. Bipartisan legislation is led by Reps. Chu, Fitzpatrick, Blunt Rochester, and Bacon, and Senators Murkowski and Hassan. The annual cost of emergency room visits and hospitalizations for eating disorders is at $239 million per year. This bill led to cost savings by ensuring individuals have comprehensive treatment coverage that will avert relapse into higher levels of treatment. So I'm asking Senator Coons and the team to co-sponsor the Nutrition Cares Act. It is the economic cost of eating disorders. And the annual loss of well-being per year is almost at $1 billion at $965.2 million. Just last year in the state of Delaware, there was 159 ER visits, there were 69 inpatient hospitalizations, and that was costing anywhere from $86,000 for the ER visits to over almost $630,000 for the inpatient hospitalizations. So in light of, this Nutrition Act, I just want to also educate a little bit more on the lack of access, don't have any access. And I will probably be back sooner than next year because something has got to change. Side note, I'm very appreciative if you guys can co-sign this, and we guys still have a lot of work to do. I'm graduating next year. My goal is to try to I'm going to be getting my PhD after that, and my goal is to try to figure out how we can bring eating disorder care that is billed as a medical benefit to the state of Delaware. That can happen at the inpatient level of care. And I know your daughter has a lot of experience, and you do as well, and I do as well. It's the acuity kind of basis of this, but I've been seeing similar models at CHOP and at Nemours where they can bill like PHP IOP, which is day program, and then inpatient where they actually bill it as, like some sort of, it's part of a medical benefit, of insurance. So it's something that I would really want to look into, and maybe that's not the correct verbiage, but I've seen it done for adolescents, and I really want to implement that in the state of Delaware. But thanks so much for listening, and appreciate your time.